Good day, everyone. So, my report is about the Entamoeba histolytica. This report encompasses the definition and characteristic of Entamoeba histolytica, its mode of transmission, the diseases and illnesses that it brings, its life cycle, and the diagnosis and treatments for the infection brought by this Entamoeba histolytica. So first, let's define and figure out the characteristic of Entamoeba histolytica. So Entamoeba histolytica is an amoeba. An amoeba is a name given to any single cell microscopic animal with jelly-like consistency, irregular, and constantly changing its shape. They are found in water, soil, or even damp environments. They move when fed by means of flowing extensions of their body called pseudopodia or pseudopods. They are transmitted through contaminated water and food, so it is expected that it can infect the liver and other organs of the body. It is also the agent of amoebic dysentery or Amebiasis, a disorder with inflammation of the intestine and ulceration of the colon. It was first described in 1903 by Fritz Godin and named it Entamoeba histolytica or E. histolytica. As its name suggests, histolytic or tissue destroying. It also means the disintegration and the dissolution of the organic tissue. It is 10th the size of a dust mite, but it infects 50 million people worldwide and kills as many as 50 to 100,000 each year. So it is estimated that 10% of the world's population is infected with E. histolytica. Its scientific classification as follows: domain Eukaryota, phylum Amebizoa, family Entamoebidae, genus Entamoeba, species E. histolytica, host range are humans and primates. So higher incidence of the infection and the transmission of Entamoeba histolytica occur in areas of tropics with poor sanitation. It is commonly visible in mental institutions, prisons, and also can be found among sexually promiscuous male homosexuals. Next is the mode of transmission. So first mode of transmission of the Entamoeba histolytica is the fecal-oral route, or what we call rectum-oral route. It is by means of the ingestion of contaminated water and food, direct hand-to-mouth, vegetables irrigated with sewage-polluted water, in which this route can aid to be this Entamoeba histolytica infection can be transmitted from one person to another. Next is agency of flies, cockroaches, rats, and etc. Third, sexual contact via oral rectum route, or what we call anal sex. Fourth is the fomites, or public places, public comfort rooms, and door handles. So this slide illustrates the 6F, or the 6th mode of transmission, which is first F is the fecal-oral route, or the anal-oral route, or rectum-oral route, in which the anal is the exit point and the mouth is the entrance point, in which like the feces from the anal can be contacted with their mouth. Next is the fingers, or dirty fingers. It is another mode of transmission because cysts can be found under the fingernails, in which, if put into the mouth, can be a mode of transmission. Next is the food. Food watered by the sewage water, and food that is contacted with rats, cockroaches, and flies can be also an agent of transmission. Next is the flies. Flies, rats, cockroaches, and other insects that may contact to the food or will have a contact to your mouth can be a mode of transmission of this infection. Doorknobs, public doorknobs, comfort room, and any public places that is common to one another is also an agent of transmission. Next is the feces, which is the common mode of transmission. The feces can also be a diagnostic tool for the health professionals to diagnose and identify if a person has this amebiasis or experience infection through the Entamoeba histolytica. 70 to 80% of the infection and the transmission of Entamoeba histolytica is transmitted through the 6F, which is, as mentioned, fecal oral route, fingers, food, flies, feces, and fomites, while the remaining 10 to 20% is transmitted by blood, example is malaria and leishmania. So let's move on to the diseases and illnesses brought by this Entamoeba histolytica. So the common diseases is Amebiasis. It is a disease caused by Entamoeba histolytica that, when symptomatic, can cause dysentery and invasive extraintestinal problems or the liver abscesses. It is contagious and may stay contagious for weeks to many years if untreated. It has worldwide distribution and is a major health problem in China, Southeast and West Asia, Latin America, and especially Mexico. So we belong to the Southeast Asia, so this amebiasis is also a major health problem in our place. Only about 10 to 20% of infected individuals show symptoms of the infection. This includes loose stools and mild abdominal cramping, which is visible in 1 to 4 weeks as early symptoms. And if the disease may progress, you will experience the frequent watery or bloody stools with severe abdominal cramps may occur, or the amoebic dysentery, liver tenderness, and fever, abdominal tenderness or stomach pain, appetite loss, weight loss, fatigue, anemia, and occasional will cause skin lesion or the image shown. So because of that symptoms, the health professionals now can identify or can diagnose what range of infection do you have. So you are classified or diagnosed with acute amebiasis if you presented symptoms of diarrhea with frequent small and often bloody stool. You will also be diagnosed with chronic amebiasis if you experience gastrointestinal symptoms plus fatigue, weight loss, and occasional fever. Extraintestinal amebiasis can be diagnosed if you have parasites spread into other organs and most commonly the liver, and may eventually cause liver abscesses. So next is the life cycle of the Entamoeba histolytica. So this is the life cycle of Entamoeba histolytica. First is the letter A. Cyst. Cysts and trophozoites are passed in feces. Cysts are formed in formed stool and trophozoites are found in diarrheal stool. Infection with Entamoeba histolytica occurs via the ingestion of this matured cyst through contaminated food or water. So once ingested to the body, the process of excistation occurs in the small intestine. So excistation is the stage in life cycle of parasite in which it escaped from a cyst after being swallowed by the human as its host. So in excistation, the cyst now disappear and the parasite escape. And during the excistation, the trophozoites are released. And then the trophozoites in the body will be transmitted into the large intestine. So the trophozoites now have this three routes. First is the invasive amoebic colitis, asymptomatic colonization, and the hematogenous spread, liver and other organs. Invasive amoebic colitis, when the trophozoites may remain confined into intestinal lumen, but asymptomatic colonization if the trophozoites will continue to pass into their stool. But if not confined to intestinal lumen and not passed into the stool, the trophozoites can infect the liver and other organs, or what we call hematogenous spread. Now, if the trophozoites have this asymptomatic colonization in which it will be passed in the stool, the encystation occur. The trophozoites undergo binary fission, or the multiplication into two, and this encystation is the process of forming a cyst or becoming enclosed in a capsule. So when the trophozoites undergo binary fission, encystation occur and the cyst will be now produced. So in excistation, the cyst is vanished and the trophozoites are released. But in excistation, the cysts are now released. That's why it has the trophozoites and also the cyst. So both are excreted in the feces, And cyst can remain infectious in environment due to its wall. It can survive days to weeks in the environment, but trophozoites pass in the stool are rapidly destroyed once outside. The bo- if the body will ingest these trophozoites, it will not still survive because of the gastric environment of our body. That is why in the first stage, matured cyst is only the ingest ingested by humans, not with trophozoites. So let's proceed to the diagnostic and treatments. So, health professionals diagnose the infection brought by this Entamoeba histolytica using the fresh stool, wet mounts, and permanently stained preparation. Trophozoites can also be identified in aspirates or biopsy samples obtained during colonoscopy or surgery. So if the health professional cannot diagnose the uh, person with the use of fresh stool and the biopsy samples, there are also over-the-counter kits like enzyme immunoassay or assay for Entamoeba histolytica antibody detection and antigen detection. So treatments include pharmacological therapy, surgical intervention, and preventive measure as appropriate. So there is the intervene of the surgical intervention if you suffer for worse infection or worse na imuhang sakit. So these diseases can be treated at home or can be an outpatient. That is why there are over-the-counter medicines like metronidazole, a drug choice for symptomatic invasive disease, paramomycin, a drug for non-invasive disease, and diloxanide for rape. If you will have this amebiasis, you will experience dehydration or the shortage of water in our body. So it is advised that you must increase your fluid intake. This includes coconut water, buttermilk, black tea, herbal or garlic tea, oregano, and apple cider. So the prevention of the infection are first, proper hygiene. Second, proper disposal of human waste. Third is water purification. Fourth, frequent hand washing. And fifth is heating of an eaten food. So that's all, and thank you. God bless everyone.